Hey, welcome back to Table Talk. Today we're going to talk a little bit about injuries and how long it takes to actually kind of recover. And that's a little bit different for everybody, but there are some factors to consider. So one we got to consider is what type of injury was it? Did it happen a long time ago? Is it new? Is it an acute injury? Did you have, like, for example, did you have a car accident or did you have a slip, spill, or fall? That might impact how quickly something's going to heal. Another thing is it old versus chronic, and also what type of work you do. All of those things are going to factor into this because, I mean, for example, if you're doing this every single day and you're moving your shoulder every single day, this is going to be more on the micro trauma and it's going to occur over time, and then eventually it'll come in there. And that's been a chronic issue. You probably didn't know that it was there, and then all of a sudden, bang, it pops up. You have no clue where it came from, but it's a chronic issue. It's been there for many, many years, and it might take a while for that to also resolve. So a couple things to consider here, right here up on the board. If you look, again, you have the type of injury is acute. Is it accumulative? That's what we just talked about. How long ago was it a very long time ago? Was it 30 years ago? Was it new? I mean, things that tend to be there longer also have scar tissue built up around it, which is kind of like glue. And you can imagine if you had like 20, 30 years of scar tissue built up around something, the joint's just not going to move the way it would had you just been kind of like fresh, so to speak. So, that's also going to be affecting it. And then if we're looking at, the areas that were damaged are also going to tend to be the areas that will also have pain that come up years later too as well. So those are things to consider with how quickly something's going to heal up. Obviously, there are time frames, just like if you like sprain an ankle or if you hurt yourself. Usually those kinds of things take only about 6 to 9 weeks to heal up. Um, Most typical nerve injuries can take anywhere between 6 to 18 weeks, depending on what is going on there to heal up. Depending on if the nerves are involved, depending on if there's soft tissue involvement, and sometimes there's usually a combination of both. So that is always something to consider when we're looking at heal time factors. And as always, we do give you a lot more information or different health topics. We talk about a variety of things, and as you can see right up behind me here, we have been talking a little bit about salts with some of our patients. I might bring that up again, and we'll talk about mineralizing your body with a good salt in the morning to help out with hydration, proper nerve function. So we'll talk about those kinds of things. We call this table talk for that reason. We're going to probably talk a little bit about benign vertigo and a little bit about scoliosis without pain and why you would want to correct it. So these are the kind of things that we do talk about on an ongoing basis, and this is why we call it table talk, because we're always going to be talking about new things with our patients. So keep tuned in, and we'll keep giving more information. Take care, guys.